A new variant, the so-called Omicron variant.
We don't know a lot about the variant except that it is a great concern. It seems to spread rapidly.
This variant is spreading around the world.
Continue to meet daily with state and territory counterparts to examine the nature of the variant.
New variant, there are many things that we just cannot know at this early stage.
The World Health Organization on 26 November designated the COVID variant B11529 named Omicron, a variant of concern. Researchers around the world are conducting studies to better understand many aspects of Omicron. According to WHO, preliminary evidences suggest there may be an increased risk of infection with Omicron. People who previously had COVID-19 could become reinfected more easily with this variant. The research on Omicron has begun around the globe, but it is not yet clear if this new COVID variant is more transmissible than other previous variants such as Alpha, Kappa, Delta, and etc. The preliminary research suggests that there are increasing rates of hospitalization. However, this might be because of increasing overall number of people becoming infected rather than a result of a specific infection with Omicron. This virus that belonged to a lineage named B11529 variant can be even more transmissible and can invade immunity offered by current vaccines. According to WHO, preliminary evidence has suggested that there may be an increased risk of reinfection with Omicron as compared to other variants of concern. The new COVID-19 variant, Omicron, has triggered global alarm as governments around the world declared to impose new travel curbs. The new strain, first detected in South Africa, has now spread in more than 10 countries, including Canada, UK, Netherlands, Denmark, and Australia. Because of fears that the new variant has the potential to be more resistant to the protection offered by vaccines, there are growing concerns around the world that the pandemic and associated lockdown restrictions will persist for far longer than hoped. Even though the actual symptoms are not yet known, but as per Dr. Coates from South Africa, the symptoms include extreme tiredness, mild muscle aches, a scratchy throat, and dry cough, while only a few of the cases showing slightly high fever. Nevertheless, she observed that the symptoms displayed by patients infected with Omicron variant were mild. The unfamiliar symptoms is leading alarm that the patients were not showing an illness likely caused by the Delta variant. This Omicron mutations raises concern, but the variant may remain vulnerable to current vaccines. If not, revisions will be necessary. ICMR scientists told that vaccine may provide only partial protection against this new heavily mutated variant, and also added that Omicron may get affected to all those who are vulnerable or not vaccinated. Here's what the World Health Organization, the top UN health body, has said about the Omicron variant and what countries and people should do to protect themselves from this mutant virus. Precautions to be taken are social distancing, wearing masks, to be vaccinated, avoid poorly ventilated and crowded places, and avoid going out unless it's important. Take care.